She's the director of PHFI, Royal Norway Embassy Universal Healthcare Initiative. She's a senior public health specialist and scientist as well. And we are fortunate enough to have her here and to listen to her address. With pleasure, I invite Dr. Priya Balasubramaniam Kakkar to address us. A round of applause for Dr. Priya, please.
Good evening. It's been at the end of a very long day, and I promise to keep it short. I'd like to thank ELETS and the Honorable Government of Rajasthan for giving me this opportunity to attend this very interesting conclave and to participate in it. I really prepared to be part of a larger panel discussion, but I'm now privileged to address you as a special addressee. I will keep my remarks short. I am a research scientist at the Public Health Foundation of India. We're a public-private partnerships. Speaking of PPPs being the modus operandi of the topic today, we are based in Delhi and have institutes in Gujarat, Hyderabad, Shillong, Meghalaya, and in Bangalore. Basically, we are a public health foundation. We're instituted to build capacity in public health in the country, and we focus across a couple of areas. We do public health research, which involves epidemiology, understanding burdens of NCD and infectious diseases, and we assist state governments by providing more evidence-informed information for them to be able to make decisions for a vast number of programs that they undertake on a daily basis. We also are involved in implementation of some of the intervention programs as well as evaluations. And more importantly, we are involved in training public health scientists in the country. We offer MPH degrees in Gujarat and Hyderabad, as well as special diploma courses in public health, in health economics, systems, public health systems management, as well as epidemiology, along with a range of biostatistical courses. We are available at www.phfi.org if you want to look us up. And for those of you who are actually interested in visiting our campus, we're based out of Gurgaon in New Delhi. That's our flagship campus. It's been a very interesting conclave, and initially I came here prepared to listen to fellow experts talk about insurance and insurance models. One of the things that PHFI has actively been involved in, both from a research capacity and also from an advocacy capacity, is really this whole concept of universal health coverage. For those of you who are not very familiar with this term, it's really about providing universal, equitable, good quality health services to all the population and not just the BPL populations that many of the states are choosing to do initially. Universal health coverage also has now become what is called a newer set of global goals called the Sustainable Development Goals. Many states here, and there are so many experts from the region, are very familiar with the MDGs, the Millennium Development Goals, that have long set the agenda for health progress in the country. You have maternal indicators, you have infant indicators, you have mortality rates, all of which the country has definitely inched and made progress over the last couple of years. But that's changing, and just as health and investments in health are now closely connected with economic progress and growth, so too are country-wide approaches to health and well-being across the globe. And universal health coverage is really one such movement. Right now, as we speak, there is the UN General Assembly around the Sustainable Development Goals. There's been a new Lancet article on where India ranks, insofar as Sustainable Development Goals are concerned. Unfortunately, we kind of rank a low 42 out of 100. We lag behind Malaysia and Sri Lanka. But the good news is we are still ahead of Pakistan. So, but that should not be any consolation for us. We still do have ways to go in terms of healthcare. And while health insurance is no doubt a very positive outcome to reduce catastrophic out-of-pocket expenditures that are crippling the citizens today, One of the things that hospitalized insurance does not do is really take care of outpatient care. And unfortunately, outpatient care is what causes the maximum household expenditure on health today. As per the National Health Accounts 2012-13 that was recently released, our household expenditure, that is out-of-pocket individual household expenditure on health, at an out-of-pocket level, still hovers at an astronomical 79.2%. So we still have a long way to go. My only comment is that as we progress, and as states like Rajasthan, more recently Tamil Nadu, progress towards insurance-based mechanisms to cover a targeted population, let's not forget the all-important continuum of care that the PPP model a little earlier so well exhibited. The fact remains that in the pursuit of catastrophic health expenditure and hospitalization, let us not leave behind the growing gaps between primary care and secondary care. What has to be done by progressive governments like that of Rajasthan is to really build this continuum of care, and perhaps the expert speaker after me, as she explains the Bama Shah Swasthya Bima Yojana, which of course targets hospitalization, may also touch upon what Rajasthan may propose to do to really bridge those continuums of care between primary, secondary, and tertiary. So thank you very much for your time.
Thank you, ma'am. Ma'am, we request you to be on stage for. This was a special address by Dr. Priya, and ma'am, please join us on stage. And I request Ma'am Vinita Singh, Joint CEO of BSUI, to present a memento to Dr. Priya for this special address. Now we are, a round of applause for Dr. Priya, please. Now we are starting with the